Hello, everybody. Thank you so much for joining us this evening or this afternoon, wherever you might be. This session is on medical trauma in adults with spina bifida. My name is Juanita Panliner, and I manage the Spina Bifida Association's National Resource Center. Today, we are joined in the background by my colleague Gianna Mills, SBA's Director of Marketing and Communications, and I want to thank her for her help with the technical aspects this evening. Before we get started, just a couple things I wanted to mention. You will remain muted throughout the session. However, if you have any questions, please feel free to put them ideally in the Q&A. You're also welcome to use the chat function. We'll be monitoring both throughout the session. Since you registered for this event, you will be receiving an email in a couple of days with a link to the recording. And then a few days after that, it will also be available on SBA's YouTube channel if you wanted to share it freely. Closed captioning is enabled. And also just to let you know that time permitting, throughout the session, we will want your questions and your chat, and the presenters will do their best to answer everything within the session. And then additionally, it's possible that we might run up a few minutes after the hour because there's so much good content to share. So if that happens and you need to go, we totally understand. You may leave, but it will be recorded. So whatever you miss, you won't really miss. And with that, I would like to introduce today's experts. We have Courtney Daly. Courtney Daly is a licensed clinical professional counselor. She's been practicing for 10 years, and she lives in the chilly northern suburbs of Chicago. We have Caitlin Shemis. She is a person living with spina bifida and hydrocephalus, and she has experience with really awesome support groups that I've been able to get to know about a little bit in my experience with the National Resource Center. And Michelle Arthur is a registered nurse and a person living with spina bifida. And she is in Indianapolis, and I forgot to write that down. So, and now, before we get started, we'd like to hear a little bit more about you. And let's start with Courtney.
Hi guys. So my name is Courtney Daly. I am a person living with spina bifida, and tonight we're going to be talking about medical PTSD. And this is a very important topic to me, as well as within our community. And it is a topic that I have found throughout my experience and throughout the years of working in the clinical setting that isn't really talked about. And it was really important to me to shed some light on it. So tonight we are going to have two great panelists with me. We're going to talk about our life experiences. We're going to talk about all of the ins and outs of what PTSD is. How do we diagnose it? How do we manage it? And doing all of those things in between. How do we live with this particular diagnosis along with living with spina bifida and having a really good life? So I'm going to go ahead and I'm going to present to you guys a presentation, and we're going to start that right now. So give me 1 second. And here we go. So about me, I'm a licensed clinical professional counselor.
Hey, Courtney, we cannot see your presentation yet.
Oh,
it's not up there.
Give me 1 second. Let's see. How about now?
Yep, there you go.
Okay, perfect. So again, a little bit about me. I am a clinical professional counselor. I've been practicing for about 10 years. I'm currently in the process of opening my own clinical setting, and I'm going to be doing private practice. So that is a very big milestone for me. I'm also an adult that lives with spina bifida. Currently, I'm living in the northern suburbs of Chicago with my partner, and we are looking to get a dog. So I'm very excited about that. I'm very excited. Let's see. So the objectives for tonight are, we're going to talk about what PTSD is, what are some of the short and long-term effects of it, some risk factors for PTSD, There's also some co-occurring conditions that can happen with PTSD, specifically what medical PTSD is and how it involves spina bifida. And that's our main, topic for tonight. How we diagnose it and management and treatment. So that's what we are going to be doing. So PTSD, when we think about it and when we hear about it in the media and when we hear about it in general, we think war, we think veterans, we think people who have been through very quote unquote traumatic events, right? But that over the years, we have realized that there are what we call little t's and big T's of trauma. And all of these are encompassed under what is called post-traumatic stress disorder. It is a mental health condition that some people describe as they experience or witness a traumatic event. The traumatic event may be life-threatening. It could be something physical, emotional, or a spiritual well-being. PTSD is a thing that we, again, associate that it only happens to adults, right? It happens throughout the entire lifespan. It can happen as far as, as little as infants, all the way up until geriatrics. That's the thing that we've learned. Trauma does not have a specific age range. People with PTSD can have really intense, intrusive thoughts, really intense, intrusive emotions, feelings about the thing that they were traumatized by. And it can really have a negative impact on your daily living. PTSD also involves stress responses like anxiety, depressed mood, or feelings of guilt or shame. Having a flashback or nightmares. That's something that is very portrayed in the media, as we can see on TV shows, medical dramas specifically, war documentaries or shows about things like that. You always see the quote unquote flashbacks or the nightmares that people might experience, but it can also be very subtle things too. So we have to keep all of this in mind. Everything is under a spectrum. There's also things that people can avoid, situations, places, activities related to the traumatic event. So for people that are living with spina bifida, it can be really, really difficult because think about it. We have to go to doctor's appointments every 6 months to every year, right? We have clinic days. And if you've had a particularly traumatic experience at clinic and you have to relive that every single time that you go back to the doctor, that really does take a toll on your mental health. So unfortunately, those who do live with spina bifida get re-traumatized a lot within our life. And that's what makes this diagnosis really difficult at times. And these symptoms, all of these cause distress and interfere with daily functioning. And that's the thing that we're really trying to shed light on. So let's talk a little bit about the short-term and long-term effects of trauma. So there's acute stress disorder, which is short-term, and then there's complex PTSD. And the current research that we're doing is really, really beneficial for complex PTSD because we're finding that majority of people who suffer from trauma suffer with complex PTSD. And you have to treat it specifically different because it is a long term instead of short term. So examples for the complex PTSD are long-term physical or sexual abuse, long-term domestic violence, war, and specifically, like I said, medical PTSD. When we're re-traumatized over and over and over, it really does physically, we found through scans, through research, that it literally changes the physicality of our brain. And so that is a major thing that impacts our daily life. People with CPTSD typically have PTSD symptoms in addition to extensive other emotional regulation issues, sense of self issues, and it can also impact your relationships. Some risk factors for PTSD. The unfortunate thing is there there's no set thing that is going to say you will get PTSD, right? But there's some things that we can look out for. PTSD, like I said, affects everybody with all ages. People with PTSD have intrusive thoughts. Let's see, okay. Let's see, we did that. Okay, the risk factors. So we're going to talk about the risk factors. Like I said, we are automatically at risk for PTSD given our diagnosis, spina bifida. With spina bifida, we are predisposed to anxiety and depression, and we know that through the research. We know that through anecdotal data. We know that through longitudinal studies, right? So that is automatically puts us predisposed to developing PTSD. Again, certain types of trauma, particularly military, combat, or sexual assault, trauma during childhood, again, we are repeatedly traumatized due to our medical histories, right? Surgeries. We had surgery when we were first born. That's immediate trauma. We have injury to during a traumatic event. We have the other things that are risk factors are lack of social support after a traumatic event. Something that is really common within the PTSD or the spina bifida community is lack of social support, lack of family support, lack of community resources. All of these are risk factors to PTSD. So let's talk about PTSD and co-occurring conditions. So we know that spina bifida, we're predisposed to anxiety, depression. Some people have mood disorders. We also have NVLD, which is nonverbal learning disabilities. And if you have hydrocephalus, 9 times out of 10, you have a learning disability, and that's NVLD. That is also a co-occurring thing that can happen, and it is an increased risk for PTSD. People with PTSD have an increased risk of suicidal thoughts, and that's also something that can happen and is very common. And again, depression and anxiety we know are co-occurring with PTSD and spina bifida. So this is where it gets tricky. PTSD has a specific criteria that we have to meet in order to be diagnosed. Medical PTSD is basically when we have to get diagnosed with it, it is a medical history that we're going to give to me, a clinical professional, and we go through a list of symptoms with you during a session, and we say, hey, what has your medical history been? And we go through the symptoms that you might have experienced, and say we've had a surgery, say we've had multiple hospitalizations. We go through that whole mental health history with you. And if you end up meeting the criteria for PTSD, you might get a diagnosis. Now, here's the really tricky part: resources. We don't have the resources that people need to go get diagnosed. So when I tell you that I've met so many people within our community that have medical PTSD but don't have a diagnosis, so they don't think it's real, that is such a common misconception throughout our whole entire community. And it is 110% true. You have it, but it wasn't diagnosed by a quote unquote professional, so you don't take it seriously. And that's something that we really do need to address, because we know that you do have it and there are resources out there. It's just we need to find them for you. So a healthcare provider is going to, like I said, do an exam, go through a questionnaire, and you can formally be diagnosed if you are able to do so. So again, we go through the DSM-5, it is called, and that is our diagnostic criteria for PTSD. These Some of these things, in order to meet the diagnosis, you have to at least had for at least a month, or at least must cause distress or issues within your daily function. The symptoms of PTSD fall into 4 categories, and those are intrusion, avoidance, changing in thinking and mood, changes in arousal, and reactivity. A diagnosis requires at least 1 intrusion symptom, 1 avoidance symptoms, and 2, let's see, 2 thinking and mood symptoms, and 2 arousal and reactivity symptoms. So when you're talking with your mental health provider, they're going to essentially look at all of your symptoms and say, okay, you meet the criteria for this, this, and this. And then they're going to say, okay, you do meet the criteria for a PTSD diagnosis. Then you're going to come up with a treatment plan with your care provider. And that is how you're going to hopefully get through the symptoms. So PTSD management and treatment varies throughout any therapist that you go to, but we in the field have many different types of different modalities that we can use. And one is CBT. That's the most common, and that's the most that you're going to see when you do search for a provider. A lot of people are going to be trained in CBT. But we've also learned throughout the years of research that we have different ways to now tap into different parts of your brain, which is really cool. And there's different ways that we can now reprocess trauma. And those are through EMDR therapy. And that is a specific type of therapy that you have to be trained for, but there's also a lot of different providers that can do that for you. There's group therapy. Group therapy has been super beneficial for many, many people due to the fact that they have a shared experience. And that's what you're kind of going to learn here tonight too. We have a group of people tonight that are going to talk about their shared experience that we've all had. There's also prolonged exposure therapy, which is a type of therapy that you are exposed to the thing that actually caused you trauma, but we're going to do it in a safe way. We're not going to do it in a way that is going to be traumatic to you. So that could mean that you are going to the doctor's office with your care provider and you are sitting in the room and you're reprocessing something that might have happened. And then there's also trauma-focused CBT, which is just another form of CBT, except we focus more on the trauma and we focus more on the body. And that helps you reprocess things in a safe way. There's also medications. Everybody that comes into a treatment usually gets assessed for some sort of if med management is going to be necessary. Medications can be very, very helpful short-term and long-term with symptoms of PTSD, depression, and anxiety. There's antidepressants, there's anti-anxiety meds. Anti-anxiety meds are probably going to be used short-term. Antidepressants are going to be used long-term. And I'm sure Michelle can also shed some light on some of those things for you guys too. So the thing that we're all waiting for, right? The thing that we're all wondering, how do you get help? What do you do for this particular thing, right? So the number one thing that we have to do is we have to advocate for ourselves. And that starts at such a young age. Parents who are here tonight of kids that are young, you have to start teaching your kids advocacy early. And that means talking about their feelings and talking about giving them the vocabulary that they need to express that they might be scared, that they might not have, they feel like they don't have control or they feel like they don't have a choice. Making sure that you're giving your kids those opportunities to express that to you. Looping in your medical team and your medical providers is going to be number one, because we always focus on the body, right? When we're in clinic and we're doing all of these trips to, clinics every year, right? We focus on ultrasounds, we focus on x-rays, we focus on MRIs and scans, right? Nobody sits down and asks you, hey, how are you? How are you feeling? What has this been like for you, right? What has your experience felt like? So talking to your medical providers is going to be really, really helpful. Talking to your trusted adults, trusting, your parents, teachers. Specifically, when you are at clinic, a resource that is very underutilized is social workers. Every single hospital has a team of social workers, and we need to make sure that we're utilizing those. If you're in clinic and you notice that your kid might be having behavioral issues or having, issues that you feel like are a little alarming, ask for a social worker and say, hey, would it be possible to have somebody come in and talk to my kid? Another awesome resource that I absolutely love is Child Life. If you guys don't know what Child Life is, they are a resource within the hospital, and they help provide very good resources to help explain developmentally appropriate ways for your kids to understand medical procedures. They provide toys, they provide distraction, all of the things that can help your child have a normalized experience within the hospital setting. Like I said before, search for a specifically trained therapist. What you're going to want to look for is trauma-informed therapy. You're going to want to look for somebody who has experience within chronic illness, disability, and we're going to go through it over in the end, but there's ways for you to, websites that you can go to that you can click specifically for these types of things when looking for a therapist. Another resource is a school counselor or resources within your community. Hospitals, at local SBA chapters, Facebook groups that, I'm sure are readily available, support groups otherwise. And those are the things that you can use to hopefully get the help that you guys need. Let's see. These are some of the resources that we have. We can go over those later. And then we are now going to talk to Caitlin and Michelle.
Hey all, excuse me. Hi all, my name is Caitlin Sheamus. I am a person that's living with spina bifida and hydrocephalus, and I also deal with medical PTSD. A couple things about me. I also do, I position as a community network leader for the Hydrocephalus Association, and 10 years ago, can't believe this year, 10 years ago, I helped launch a spina bifida support group here in Pennsylvania, which has been awesome. I'm on the advisory council for the SBA. And I just threw in a little fun fact. I have a little cat who I love to death. I'm a cat mom. So her name is Sassy. She's behind me. So, but those are some fun little facts about me. Next one. There we go. Just a few little things. Of course, as I mentioned, I have spina bifida. I was diagnosed in utero with both of those. I have congenital hydrocephalus. I'm an L3, I believe, in spina bifida. And in my early 20s, after a lot of years of dealing with different things, as Courtney was mentioning, just having different experiences and other things that I didn't really know what was going on, I was diagnosed with anxiety and depression at about 25. So that was a whole new experience for me. I wasn't sure what to expect. So as I said before, I experienced anxiety at a really young age. But at the time, I didn't know that that was what I was experiencing. I would just get really emotional about stuff. I didn't know what that meant until I really did some research on it and everything later. People would say I would be overly emotional. Um, had a bunch of other things to say about me, like as far as just like the depression would cause like me not to be able to complete tasks. A couple other things that just seemed to happen, and I was labeled a lot of things, and I wasn't sure how to cope with that. Um, but my experiences then led to really being nervous and anxious when I would go into surgeries, even basic appointments. I would go in and expect that something would come out that would be wrong or anything like that. Um, I've had plenty of those experiences because I have had plenty of diagnoses that I've had to work through. Um, and of course, the last one being new doctors. Just having to either explain what spina bifida is or hydrocephalus or any of those, or going through excuse me, I don't know what that was, going through just that process of new doctors and having to go through my story and reliving some of the things maybe I never really wanted to relive. So that was kind of that. Next slide. Um, I'm a huge advocate for mental health. Mental health to me is so important just because of the experiences I've had and the help that I've gotten over the years. As I said, I got mental health help in my 20s. Really wish I would have went sooner. But things happen. um, so I just wanted to put some things out here that have helped me and maybe that would help somebody else too. Being aware of triggers. Triggers for me were always medical appointments, things like that, that I didn't know like why I was getting so anxious. Like my blood pressure would like skyrocket and I wasn't sure how to manage that, but it happens. So I started seeing a therapist in my early 20s after not even having an experience with medical stuff, but my own personal relationships and things kind of crashed at one point, and I finally just said I needed help. And I encourage anybody to do that because it helped me immensely. Um, so a couple of techniques that I've learned that helped me were deep breathing, which is obviously just practicing how to deep breathe in those situations. It calms me down. I don't know like the brain thing. I have to talk to Courtney a little bit to see like how the brain works with that. But that helped me so much because even in these situations, I usually am shaking, I'm usually stuttering, I'm usually doing all that. I'm living proof that some of those things do work. And of course, the tap method, that's really, really interesting and maybe sometimes dumb, but the tap method helped me because you have to stay focused so much on the sequence of what you're doing. That helped me for some odd reason, and I don't know how else to explain that. So that was how that worked for me. I found this quote online and it honestly like spoke to me and I hope it speaks to others. But PTSD, it's not the person refusing to let go of the past, but the past refusing to let go of the person. That spoke to me because speaks to my mental health. It speaks to me in general as far as my life. And I hope that that really speaks to somebody else. Next slide. So we've talked about how I've gone through the process of diagnosis and everything. How do we combat that? How do we overcome those things? So for me, combating medical PTSD started with therapy. Started with therapy. That is my main like plead for people is that if you are really seeking help, even if you're like afraid or what or anything, please go get help because the more you prolong that, the more it's going to give you more anxiety to go get it done. um, and then I discovered when I needed help. I had a moment of I can't do this by myself anymore. I need something else. So I talked with my parent, my mother, who is like one of my best friends, and I said, hey, here, like let me do something to help myself and maybe help others around me to understand what's going on. So the other ways that I started to overcome medical PTSD, it took opportunities like going back to doctors, going back to other things that I didn't do before. Um, again, as Courtney said, medical places, they are my nemesis. They were always my nemesis on things. Um, I had an experience a year ago. I had an amputation because of a pressure sore that ended up on my leg. That literally made me jump back into going to all my medical appointments, all of my medical things. So it was a tragedy that happened, but it also was what reset my brain to go back and do those things that I didn't think I could do. So just pointing it out there, take care of yourself. And of course, being the last one, taking better care of yourself. If you don't have any of those problems, you don't have to see a medical professional for a very long time. And that's kind of my logic these days. If I take care of myself, I don't need to be in the places that make those things happen. So next slide. Um, so moving forward with medical PTSD, I always honor my emotional and mental health. If there's something that I can't face or at the time or whatever, I don't do that until I can really process how to do that. And I have done that. I've conquered some of those things and I feel amazing doing that. Um, the second one, and I can't emphasize this enough, know how to speak up for yourself in those appointments. Know that you have a voice as much as the doctors have a voice for you to take care of your mental health, your health in general, because that's what actually helped me to understand that I could go in there, speak up for myself, and know that those doctors, because I've had experiences in the past, and part of my medical PTSD came from doctors and people that weren't listening to me. So I now know I have a voice at 30, almost 35 years old. I have a voice and I can use it, which is amazing. And of course, I say this to everybody with a full heart, your voice matters. Get in there, talk about things. Get in there and honestly go and experience those things because you will have so much more of a better experience if you know that you're in control. And that's my little PSA. Thank you all.
Thanks so much, Caitlin. So I'm going to go ahead and talk a little bit about my own experiences with undiagnosed medical PTSD. And I do want to stress that for me, I don't have a diagnosis, but that doesn't make it any less real. And if you're like me and you've had some experiences that fall somewhere on the spectrum of medical PTSD, but maybe you don't fit all the criteria, your experiences are still completely valid. And we still have to figure out ways to live our lives to the best of our abilities. And it doesn't make it any less valid if you don't have a diagnosis. So to tell you a little bit about me, as Juanita and Courtney said, I'm an adult living with spina bifida. I'm a registered nurse. I worked for a little bit in the NICU and I've done a lot of research in an academic setting. I've actually had to kind of pivot the research that I'm doing because the research I was doing was so close to home. I was doing a lot of bowel management stuff for adults with spina bifida. And I had also been through some really traumatic things related to that. And so, I'm kind of in the stage right now where I'm pivoting and it's been a little bit of a challenge, but I'm currently working as a CLS and respite worker and a research assistant at Loyola. I'm still doing some spina bifida research, but it's just a little less close to home at the moment. I live in Indianapolis with my wife, Kylie, who's also a nurse, and my 2 dogs and our cat. So there's some pictures at the bottom because I love showing people pictures of our pets. So I picked a couple specific things that I feel like have really made an impact on my experience with medical PTSD. The first one, which I know a lot of adults with spina bifida can relate to, is that transition from pediatric to adult care. So when I was transitioning from peds to adult care, I was like in the middle of a really intense health crisis. And then I lost all my providers, and it was so challenging. I remember just having this huge feeling of helplessness, feeling like there's nobody in the world who can help me get through this. Like, what am I going to do? And that was such a heavy feeling and was really hard. Um, I also dealt with being gaslit by providers. Even when they're trying to help me, I got a lot of messages over and over again of you're fine, there's nothing wrong with you, which everyone thinks is such a positive message, but when you know in your heart that something is wrong, it can be devastating to hear over and over again, nothing's wrong, and you start to feel a little bit crazy. Um, and I think it definitely leads to feeling really isolated and alone. Like, not only, do you maybe not want to leave the house because of health stuff that's going on, pain, bladder and bowel stuff, whatever that is, but you also just feel like no one understands. And that's so hard. Um, I also have had to kind of navigate establishing and then negotiating having bodily autonomy. When we have chronic congenital conditions from birth, we are kind of told, sorry, you can go back up, Courtney. We're kind of told what we need to do with our bodies from, back from when we're born. There you go, perfect. And so it's really easy to feel like your body is not your own. And a lot of the stuff that you have to do, like really painful and uncomfortable tests or surgeries, like they're medically necessary, but they are just awful and you don't have much of a say. So that has also led to me struggling with some like physical intimacy, because I almost just want to like claim my body. I don't want anyone to touch it more than they have to outside of, what is medically necessary, even if that's like a safe touch with a safe person. And that's something I've had to really learn, and rewire my brain a little bit as I get older. And you can keep going, Courtney. So then that kind of overlaps with the bladder and bowel stuff for me personally. So I've had to have a lot of tests and surgeries that are related to bladder and bowel. And I think that's really common for those of us with spina bifida. And you have to be so vulnerable when you're dealing with that stuff. And, it's very invasive, even if it's necessary. And that can just be really hard to work through in your brain. And then related to the bladder and bowel stuff, I've always felt like I need to be on high alert. I think Caitlin kind of mentioned this too, feeling like you're constantly trying to prepare for the worst. And how am I going to manage this if this happens? Specifically with bladder and bowel stuff, incontinence, I'm not dealing with this as much anymore, but I always struggled with like, I need to know where a restroom's going to be. I need to adjust what I eat and drink if I have anything going on. I'm always planning like an exit in any conversation or any like a lecture when I was in school. Do I know where all the bathrooms are? Like, it takes up so much space in your brain. And even though I don't deal with a lot of this stuff as often, it's those thought processes are still there and the worries are still there and that anxiety is still there. And so I'm still really learning how to reframe that stuff. And the last big thing I wanted to talk about was having anxiety around healthcare providers, which has also been talked about a little bit. As a nurse, that's really hard. And as someone trying to do spina bifida research, I think everyone can probably relate to feeling like you have to present yourself in a certain way in order to be believed, in order to be understood, and to get the care that you need. And that is really challenging when you are super sick. You just don't feel like showing up as your best self, and I've even had the thought processes of like, since we have chronic conditions, we don't always look sick or in pain when we are. And so it's like, how sick do I need to look for my doctors to listen and believe that I'm sick and understand me, but also believe that I am a competent professional? I know what I'm talking about. It's such a challenge. And as a professional, I struggle with having these both like relationships with providers that are both professional and me as a patient, because there are only a limited number of providers, as you all know, that we can see that will take really good care of us if we even have any. And so when we find them, we want to do everything we can to make sure those relationships are good and we don't jeopardize our care in any way. But we need to be able to be vulnerable and be patient and show up with how we're feeling. And, I've also struggled with having providers when I'm in a patient role looking at me as like a professional and not listening to the problems that I'm bringing up, and vice versa. They don't consider me a professional because they know me as a patient and they've seen me, in my most vulnerable states, and they've seen my whole body and things like that. It's such a weird, unique, tricky thing to navigate, and I think a lot of us end up in these roles where we're working with medical professionals or we're working in the spina bifida world because we want to make a difference and we want to make lives better for people living with spina bifida. So I think we find ourselves here a lot, and it's just really tricky to navigate. Next slide, please. So I'm going to talk a little bit about how I've tried to cope with undiagnosed medical PTSD. I'm going to be super honest and say that this is an ongoing challenge for me, and I am constantly learning, relearning, and like unlearning some of my thought processes and behaviors too. A big thing that helps me and that we've already talked about too is leaning on support people in my life. And going to therapy when I can afford it. I would say specifically with therapy, I needed to find a therapist who had that chronic condition disability context. And I've actually used Psychology Today to find that. You can filter based on what you're looking for. So for me, I'm a part of the LGBTQ plus community and I have a disability. And so you're able to kind of check boxes and say, this is what I want in a therapist. And I think the people who understand that context that you live in are going to give you so much better care than someone who doesn't really have much knowledge about that. And also, like, finding people who have spina bifida has been really helpful for me. So this is not a plug for SBA, but I feel like the more I've done things with SBA, I've gotten connected with other adults who have spina bifida, and I have been amazed that so many people have such similar experiences to me. Like I remember when I was in the worst of like health crises, feeling like I was the only one who was going through this and feeling so alone. And then, I'm talking to other people and we're telling each other our stories. And it's easy to be vulnerable with them because they've also gone through this stuff and they understand it. And just like nobody gets it like they do. So that's been really nice. Finding trusted providers has been helpful for me, although it has been a very long and hard process. So I'm not trying to like sugarcoat that. I would say, I think getting established in care before you're in crisis, or even if you have like a downtime during your crisis where you're like, I feel okay today, I'm feeling okay. That is when I would really pursue care. I feel like that's when we want to just relax and be like, oh, good, I don't have to do that. But for me, it's so much harder to find care when I'm in the middle of a crisis. Um, and I've had to ask for help. Like, I've reached out to colleagues and friends and just anyone I know who could possibly help me. If you're trying to get connected with care, I would suggest reaching out to SBA, and they might be able to help you find some providers in your area that can care for you as an adult with spina bifida. And then I've also had to take some breaks, kind of like Caitlin mentioned. Like, if I'm just really not doing well, I'll take a break from pursuing care as long as I come back to it. And that's the important thing for me, is like coming back to it. Another thing that has helped me has been trying to take morals out of the equation. And this has helped me in lots of aspects of my life, but I think especially related to care, because like as a nurse, I know what's recommended, what the evidence says is helpful, and what people would say, like, you're taking good care of yourself. And I can't always do that. Like, we're all human and we all can't always do that. And so I really try to take the good and bad out of it and like take away some of that shame. It's like, well, I had energy to do it or I didn't. Because if I let the shame and like the embarrassment of, I missed that appointment and now what are they going to think of me? That's going to keep me from getting care. So I try to do that as much as possible. It's something I really have to like remind myself about. It's something I'm always working on, is trusting myself more. I think because a lot of times we are gaslit over and over again, because people can't always see what's going on with us. Like sometimes it can be a really invisible disability. So you have to just believe that you know yourself best. And something that's helped me to trust myself is like taking pictures. So I've had lots of wounds and things like that, and I'll go into a healthcare provider and say like, this is the beginning of an infection. Like I know it is, and I need to like jump on it early and start to get it taken care of. And they'll say something like, oh, that just looks like a blister. Like, no, that's not an infection. It would look like XYZ if it was an infection. And, it's like this constant battle of trying to get people to listen and believe you. And so for me, it helps to like take pictures over time and keep them in a little folder on my phone so I can look back and say, this is like the progression over time. And here are past wounds I've had. So like I've had experience with this, and I feel like that helps me to get providers to listen a little bit more. And I'll like record appointments on my phone, or I'll bring a loved one with me so that if I start doubting myself of like, what did they say? When you're like in a really anxious state, you cannot hold information in your brain as well as when you're feeling okay. And it can be really stressful to sit in these appointments, especially if you get news you weren't expecting or something like that. So I think for me, having someone there with me that I can say like, did I hear this correctly? Is this what they said? That helps me. And also just writing things down, because I tend to go into appointments and say, I guess my symptoms aren't really that bad. Like maybe I don't really need XYZ. And I do that to myself where I'm like, maybe it's not as bad as I think. And so if I write things down when it happens, like these are the symptoms I'm having, this is my pain level, this is unbearable, or whatever it is, then I can show that to them and I can look back at it myself and say, no, it really is bad. Like I really do need care. Um, I'm always trying to give myself some grace. We're all just doing our best, and this is a really complex and challenging thing to deal with. Society is not really built for people with disabilities, and our medical system doesn't always serve us. So I think it's really important to like give yourself a break sometimes and know that you're doing your best, and it's okay to do things halfway. This is something that I've been leaning into more lately. I don't always have energy to do things perfectly, and I am like a perfectionist, so that's really hard for me. I want to just be like, forget it. I can't do it perfect. I'm not going to do it at all. But I think I've been able to take better care of myself by saying like, just for a really simple example, if I don't have the energy to brush my teeth for 2 whole minutes, I can do it for 30 seconds, or I can use mouthwash, or like we're exhausted sometimes. If I don't have the energy to take a whole shower, I can like use some baby wipes and some perfume, and that will make me feel better about myself. And I don't need to, I'm still taking some steps to take care of myself. And I think it's the same for like appointments and things like that. Like if you can't show up as your best self, like showing up is better than not showing up. If you can't show up at all, you can try and like message your providers in the portal and let them know what's going on, or give them a phone call and let them know, just so that you're still keeping those lines of communication open, even if you can't bring yourself to like go to an appointment because you're so anxious or something like that. Like doing things halfway is worth it, in my opinion. A fun thing, sorry, I'm almost done, I promise. A fun thing that I really like doing is I've started taking action to kind of reclaim my body as my own. And this is something I wouldn't have been able to do as much when I was younger, because for me, it's like I have a tattoo, and that was a really fun thing for me to do. But it could be anything, whatever that looks like for you, to reclaim your body and say, like, this is mine, and making a decision about how I want to decorate it or how I want to present myself, I think can be really empowering. And my last thing is being as prepared as possible while envisioning things going well. Like I definitely am someone who needs to be really prepared. And I do think that serves us to prepare, but like when we're always preparing for the worst and that's what we're replaying in our brains, I think it's really easy to get stuck in that rumination. And so for me, I do everything I can to prepare, and then I've really been trying to picture like, what would this look like if this surgery or this appointment went really well? And like, what if it does? Maybe that will happen. So that's been kind of helpful for me. My biggest thing is I just want to say you're not alone. There are a lot of people who are going through similar things and can empathize, and this is hard, and we're here for you. So I'm going to pass things back to Courtney and keep things moving as far as our Q&A.
Can you hear me? Okay. This has been awesome. You guys have brought up such awesome points, and to piggyback on some of the things that you guys talked about. Caitlin, you talked about tapping, deep breathing, all of these different coping mechanisms that you and Michelle have both used. And that is definitely the key here. We have to get ahead of the things. We have to use our coping skills. We have to learn these coping skills. Something that also you guys, again, you guys were awesome bringing up all of these really good points. Having as many choices in anything that we can have is key to helping us process really hard things. We don't get a choice when we have surgery. We don't have a choice for doctors. We don't have a choice for medical testing. When you have the opportunity to get a choice in a hard situation, that is the number one thing that is going to be helpful for you. You want to take autonomy where it can be had. And that's, Michelle, you nailed it. It was taking care of yourself, doing things for yourself, making sure that when you want to be touched and you are, you're your boss, right? You're your own boss. You get to say whether or not this person gets to do this person gets to do that. Just because they're medical providers or we are in a medical setting does not make you have no autonomy. You have a voice. Use it and make sure that you are using it and advocate for yourself. That's the number one thing that I think we're all just trying to drive home. We had some questions that came in as far as, where to get care. We all kind of talked about it. The number one resource that I give people is to find a therapist. It's really general, but it's very helpful. A lot of great therapists are on what's called Psychology Today. Like Michelle said, you can go through and you can filter what insurance you have, what your location is, what specifically you're looking for. Are you looking for chronic illness, disability, LGBTQ? What are, a female, a male, all of these different things, and it will filter out for you, and you can then go through bios and profiles to see who you might match up with. Now, here's my little spiel. Being a mental health provider, I kind of say is like dating. You're gonna go on a few bad dates with a therapist. Sometimes it's not a match, and it's really frustrating because you're the person that has reached out and you're the person that needs help, but you have to go through this quote unquote weird introductory period that you might not click with somebody. And you're going to know pretty early on if you don't click with your therapist. If you don't click with a therapist, my recommendation is immediately express that to your therapist and find somebody else, because that's going to be the key. The relationship, if you need to be comfortable with your provider. And if you're not, real healing and real work isn't going to be done. So that's my number one thing. It's kind of like dating. You're going to go on a few bad dates, but eventually, hopefully you find a good one. Let's see. Other questions that we had, as far as adult care for spina bifida, we always refer back to SBA and all of the resources that we have. We have adult clinics that, we can hook you guys up with. Do you guys have any other resources that you guys want to share, Caitlin or Michelle?
I would just say reaching out to SBA and they might be able to help you search. Because even when they have adult clinics, sometimes they don't have the providers that you need, which can be really hard, and you can't always tell online whether they have them or not. So yeah, I think SBA might be the best resource as far as finding that, or you can, You can do a lot of searching yourself. I feel like honestly, I had to go through my professional channels and my colleagues in order to find care. So it can just be really, really challenging sometimes. I mean, you can look people up online, but you can't always tell if they serve people with spina bifida or not. So that's why I would suggest like SBA, because they might be aware of whether or not they are familiar with spina bifida. And you can always kind of ask in your first appointment if they are familiar with spina bifida, and if not, are they willing to learn? I think that is one of the biggest things.
That is one of the biggest things. Thank you for saying that, because we might find a provider that we really click with, and if they don't know something about spina bifida, ask them if they're willing to learn, because we're the experts, right? We have all of the resources, and if a provider is willing to learn, it's our responsibility to help them learn, right? And I'm not saying do this for every single provider that you ever meet, because then you're going to be even more exhausted. But what I'm saying is, if you find one that you really do click with and they have the brain space and the opportunity to learn, let's teach them, because the more people that know about spina bifida and the ins and outs of it, the better off we are as the patients.
I was gonna say too, if they don't have a knowledge of spina bifida, or they don't see people with spina bifida, they might be able to refer you to another colleague who does. Caitlin, did you have other ideas about finding providers?
Again, just because I'm very familiar with them, I work with things like this, support groups, people that have gone to reputable places that they can give you to reach out to, or that you can research yourself, to know whether that's going to work out for you or not. Um, just because I've known that, just by word of mouth, if they know that, hey, they treat people with spina bifida, that is like a gold mine these days when you hear that. So I would definitely, that's just my input.
That's a great point. And there's it's specifically a bowel management group that a lot of you are probably already familiar with, for helping people with spina bifida. But you might be able to chat with people on there if you're not a part of a support group or not really connected to SBA. That might be like an easier thing where you can talk to people and see what their experiences are. Sorry, go ahead, Courtney.
No. Perfect. I'm really glad that you mentioned that. I'm a moderator for the bowel management group on that specific website, and we do bowel and bladder questions. But what we end up doing is referring people to another group called United by Spina Bifida. And that's another very, very large Facebook group that is for other questions that are related to bowel and bladder, because we really, in our group, love to keep it on topic, because otherwise it would be the wild, wild west. We would get nothing done. So we refer to other people to the other group, and it's fantastic. They're wonderful, and they're a great resource as well.
Awesome.
And I'm going to jump in a little bit. Courtney, can you mention, I know one of the groups that you just mentioned was bowel management for spina bifida.
Yep.
And what was the other group?
United by Spina Bifida.
Oh, oops, I meant to send that to everybody and I just sent it to you.
That's okay.
Okay. I'm just putting the names of these groups in the chat.
Yeah,
So
that's
you
perfect.
can look them up. And
Go ahead.
no, go ahead.
Does anybody have any, specific mental health related questions that I can answer? Anything related to PTSD, medical PTSD, anything that I can clarify you? I know that my part of the presentation was a little bleak and boring due to the fact it was just very informational. So I want to just clarify, if anybody has any questions, please, let me know.
And there were a couple of questions. Oh, go ahead. Did you get them, Michelle?
Yeah, I was just gonna say, I see a question in the question and answer where someone said, when you say individuals with spina bifida are predisposed to depression and anxiety, what does that mean? Is it a wiring issue, or is the depression and anxiety the product of the systemic challenges we face? Could you talk a little bit about that?
I absolutely can. And that's an awesome question, because here's the thing. It's a twofold answer. It's a little bit of both. It's a little bit of column A and column B, right? Due to majority of people with spina bifida are born with hydrocephalus. There are different, things that we are predisposed to that we found throughout the research, that anxiety and depression are definitely up there. They're kind of just those co-occurring, what we talked about earlier, those co-occurring disorders. So it's a little bit of both, because you might have, the other thing that we have to think about is family history. Within your family, do you have anybody who suffers from anxiety and depression? Because those are also predisposing factors. So there's a lot of different things that can predispose you, but we also have the unique challenge of having the medical aspect of our life. And that involves all of the things that we've talked about tonight, the trauma, the re-traumatization, right? So it's kind of a twofold thing there, and it's a little bit of column A and column B.
Thanks, Courtney. I saw another question too. If I touched on it a little bit, but I wanted to see if you had anything to add. Someone said, let's say you don't meet the criteria for an actual diagnosis because your symptoms are there, but not severe enough to be PTSD or CPTSD. Is there a lesser condition? And then a part two to that, can you possibly have PTSD or CPTSD or a lesser disorder and not realize until adulthood when stuff starts coming up?
Oh, absolutely. So, there is no such thing as like a quote unquote lesser diagnosis than PTSD or CPTSD, but it all again falls under, you have to think of it as an umbrella. All of these things fall underneath the umbrella. And like we've said before, and we've kind of driven this point home, just because you don't meet the diagnostic criteria for a diagnosis doesn't mean it's not real, doesn't mean it's not there. So you can still have all of these symptoms and all of these experiences that you've had and not meet criteria. And that doesn't take away your experience. It still means that you have the nightmares, however you are experiencing it, you're experiencing it. I can't say that you don't have that. And if somebody does say that, get a different provider. But that's the whole thing. We can't take away your experience. And if you're telling me that you're experiencing something, it's my job to believe you and it's my job to help you. So you have to find the provider that's willing to do that. And if they're not, then unfortunately you got to keep looking. Like I said, kind of like dating. And what was the follow-up to that? Was there another?
Yes, it was kind of about like when things come up later, can you have it but not realize it until you get into adulthood and then stuff starts to come up?
So we actually find that's the most common thing that happens, right? So for me, my experience with medical PTSD started when I was a teenager. It happened during a very long stay in isolation due to a shunt infection. And I was in the hospital for over 40 days, and majority of those were spent in isolation. At the time, nobody talked about mental health. Nobody talked about the things that, so we didn't know what was happening. I just thought having nightmares was a normal thing. Turns out, no, it actually isn't. And it is a real diagnosis, but you find that out later. And I was diagnosed in adulthood. The commonality of that particular story is so disheartening because that's what happens to a lot of us, right? You experience all of these things in childhood, and then all of a sudden you're an adult, you get slapped into the world with no health care, no resources, and you're having all of these symptoms and you go, what is wrong with me? I don't know what's happening. And yeah, turns out you do have all of these things. Things pop up at different times. The other thing that's pretty common, which we're finding, is during puberty, a lot of these things can happen too. So early onset, because we're predisposed to early onset puberty. So hormonal changes in the brain also can exacerbate symptoms. So your younger kids, your teens, your tweens, you got to keep an eye on them too, because with all of those different changes, different mental health changes can also occur. So yeah, it is very, very common to experience things and then later be like, oh, this is a thing. This is the thing that really happened.
Absolutely. And then we had another question about, so if you don't get the label or the diagnosis of PTSD, then how do you get care? And I'll say for me, I
Yeah.
think I do have a diagnosis of like anxiety and depression, and I was able to kind of get care in that way, but it is not specifically PTSD care. So are there ways to get
Yeah.
care that's like focused on trauma without having the diagnosis?
So that's the thing. This is again therapist dependent. You're gonna want to talk to your mental health care team about these specific things. I always recommend for anybody with spina bifida and within the disability community, always find a therapist that's going to be trauma informed and does trauma informed care, because then no matter whatever you bring to them, hopefully that therapist is going to be equipped to handle whatever you're going to bring to them, and they have the tools and the ability and the skill set to be able to treat anything that you're going to basically present to them, whether it's a quote unquote true diagnostic, diagnosis or not. It doesn't matter, because they're going to have the skill set to be able to handle that.
Awesome.
Any other things that we can go over? Does anybody else
Yeah,
have a
I
question?
saw a couple. So I saw one about learning the tapping method and one about how do you break up with your therapist if you need to.
Ooh, I love that
Good
question.
questions.
So okay, tapping method, I actually put into the chat, but I'll reiterate it here. You can learn it via YouTube. I mean, there are YouTube is a wild source of information. And it's a very good resource, let me tell you. But again, vet your sources and vet your resources. You can learn it via, a video, but I always recommend you go to a mental health provider that's specifically trained in all of these different modalities to help with you cope with all of these different coping mechanisms and strategies. And what was the other one?
Sorry, I'm
Tapping.
scrolling through.
No, you're fine.
How to break up with a therapist if you know you need to make a change.
So breaking up with your therapist is kind of like breaking up with a significant other. You're literally going to tell them, it's not you, it's me. You're going to literally say that here's the best part. We're equipped to hear that, and we're ready and prepared as your mental health care provider to be able to take that. And if I'm not the right fit for you, I want to know immediately that you don't feel like this is the right fit. Because if you don't feel that this is the right fit, I'm not going to be able to give you the adequate care. So, how you start that conversation is you basically just say, hey, listen, you know what? You've done really great stuff with me. I just don't feel like we're really vibing. I feel like that I could benefit from somebody else. Thank you so much for your time. I really appreciate it. Now, the one caveat I'm going to say, because it happens in every single practice of a mental health provider, do not ghost your therapist. As appealing as that is, we would love to know, and we want the feedback to have as the provider. Why didn't you think that this was a good fit? Was it, personality? Was it modalities that we might be doing? Sometimes you just don't click, and that's okay. But always be honest and always just be upfront. We're prepared for it and we can handle it. We're professionals. It's part of our job.
I want to jump in too and say I have broken up with like several therapists just because it's so hard to find the right fit. And for me, it's always easier to like break up via message and not like in a session. So I'm still
Yep.
giving them this information that, hey, I don't think this is working. Like I'm not getting what I need out of this. But I don't
I've been
do
broken
it
up
face
via
to face.
email. Yeah,
It
I've
feels
been
less
broken up
scary.
via email, via text, if you don't want to do it in person, totally fine. That's totally your call. I'm all for it, but communicate, because when we are ghosted and we just kind of are left high and dry, we are still people, and we kind of wonder and we go, I wonder what happened. I hope they're okay, because we care and we want to know that you are okay. It is also part of our ethical code to give you resources and other referrals to other therapists. So if you do plan on breaking up with your therapist and you are afraid or have anxiety, also know that it's part of our ethical responsibility to give you referrals. So you kind of want to do it and let us know, because we might be able to hook you up with somebody else that might be a better fit for you.
I will say, from a patient perspective, I've been through 3 therapists
That
in my
doesn't surprise
10
me.
years. Huh?
Yeah. That doesn't
Yeah,
surprise me. Yeah.
I was gonna say 3, 2 or 3 at least therapists, because 2 of them were not fitting my needs.
Right.
And that's just how it happens sometimes. You have to really pay attention, because then like a year later, I found the perfect match for me. And
Yeah.
that's how I ended up getting the help that I needed. But it does take time and it does take effort to go to find the right person and that right match for you.
The number one thing I want to drive home with therapy is rapport is everything within the therapeutic space. If it's the relationship, if you don't have a solid, good relationship with your therapist, real healing and getting through things and learning how to cope isn't going to happen as effectively as it could. You're doing yourself a disservice when you don't have the provider that you are really, truly looking for. So really strive to do that. And I know that it's so difficult because, again, it's a catch-22. When we are reaching out to a therapist, 9 times out of 10, we're not in a good headspace. So it does make it really hard. But keep going, trying to find the person that's going to be the best fit for you. Also, another thing that I want to reiterate is, if you have a therapist that you have had really good rapport with and then things start to trail off, that's also a sign that you're ready to move on to a different therapist, and that might have a different modality, because different work with different therapists is going to happen throughout the whole process. You might not want to stick or have to stick with somebody throughout the entire process that you want to be in therapy.
Thank you so much, Courtney. I did see one question that I was going to direct to Caitlin, because I think maybe you might have something to add. It says, where can I find more support groups, or how can I become an advocate for this topic or create a group of my own? And I know since you've done that stuff with your support groups, maybe you can add something here.
I was very blessed and fortunate when I did, um, with 2 other amazing people, start this and launch this 10 years ago. A social worker at our local Spina Bifida clinic reached out and said, "You guys are always talking about getting people together and talking about, having that connection and seeing, people," because we had a sports camp we went to and we hadn't seen people in like 10 years. That's how the idea started. So reaching out to your local Spina Bifida clinic, your local, social worker, any of those who really want to help launch and like have a passion for doing that, because I will say it is not for the lighthearted to keep things like that going. So I would definitely reach out to your local Spina Bifida clinic.
Right.
Anybody that would like to head that up.
Thank you.
I think we need to wrap things up for time. Anything else that, Courtney, that you want to say before we sign off?
No, I just think that this was a great talk, and I thank you guys for being here, and I really appreciate all of you.